Time for some clinical peanuts.
Go ahead with the session. Today is a very interesting session because we're going to talk about FAICO. And though this exam is very popular now, but there is not much information regarding preparation and how to go about it. So we thought to have this session because it will help everyone. So we have quite a dynamic, what do you say, speakers today from cornea to plasty, and let's hope we'll have pediatrics as well, and we have retina as well. So we have for cornea, we have Dr. Pratima Vishwakarma, who is a fellow from LVPI, and after this, she has followed up with two international fellowships at Masai and at Baskin Palmer, and she has won various awards, and even she has presented paper at international levels at AO. So thank you, Dr. Pratima. Other speaker we have is Dr. Neha Ghose, who is again a fellow from LV Prasad, and she is currently a consultant at uh, yes, Sushila Netrale Nellore. And we have also Dr. Anju Chandran, who has done her fellowship from Shankar Netrale, and currently she is the head of Orbit and Oculoplasty and is even the academics director at Comtrust Eye Hospital, Kozhikode. And I think the pronunciation is right. And yes, and we'll be joined later by Dr. Prabhat Nangia, who's again a cornea specialist, and he's a very interesting personality because he has cleared both the cornea and the pediatrics FIICO. So we will try to get information on both. And we have Dr. Nikita Dash, who is a fellow from Gangaram, New Delhi, and she is an assistant professor at IMS and SUM Medical College in Odisha, Bhubaneswar. Let's hope more people join in, and we are waiting for Dr. Raghav to join in as well. And he'll also talk us about cornea. He's again a fellow from LV Prasad, and he works at Sushila Netrale, Nellore. So off to you, Dr. Pratima. Please go ahead.
Anuj, I joined. I'm now
Okay.
good. Yeah.
Yeah. Uh, Dr. Pratima, you're not audible.
Am I audible now?
Yes, yes.
Yeah. So, hello everyone. My name is Dr. Pratima Vishwakarma, and I'll be guiding you through how to clear FICO cornea. So, what is FICO basically? It is accreditation given by the AIOS, that is All India Ophthalmic Society, and it stands for Fellow of All India Collegium of Ophthalmology. And there are several like subspecialties where this degree is awarded. Like you can see, this is the list of the subspecialties here. And today we'll be discussing mainly on cornea. So what is the benefit? You can definitely get a very good accreditation, which is recognized by All India Ophthalmic Society. And since most of our fellowships in India are not recognized, this would be a recognized one. And the eligibility criteria for this is written on the website of AIOS. Firstly, you have to be a member of AIOS. The basic postgraduate qualification like DO, DNB, MD, MS is usually required. You need a 2 year of experience. Uh, Anything like during the fellowship is also considered. or post graduation, post your graduation. So that is fine. These are the other requirements, eligibility criteria, which you should go through AIOS before applying for the examination. And the cutoff usually is 3 to 6 September every year. Okay. So there are the examination is divided into two parts. First, it is a written test, which is usually conducted in New Delhi or Mumbai, Kolkata, Bangalore, Chennai, or Hyderabad. So you can select your whatever is suitable for you. They give you an option of which is your first preferred center and the second preferred center, and you can fill that in your form, and the centers would be given accordingly. Then the second part of the examination is conducted elsewhere depending on what is your subspecialty, and it comprises of OSCE and VIVA. So these are the two parts for this examination, FICO Part 1 and FICO Part 2. So the FICO Part 1 is basically MCQ examination, which comprises of 100 MCQs. 4 options would be given, and there is no negative marking. For the preparation of these MCQs, you can go through any of these MCQ books. Even if something else you like, you can try those books. Just go through your subspecialty. Like for us, it was cornea. So I went through one of the books. I selected just one because it can be like if you are into your fellowship, there can be time constraint. So basically what you need is practice of MCQs, not to mug up on anything, but practice on the timing. Like there will be 100 MCQs. Earlier it used to be 60. Nowadays it is 100 and the timing would be 120 minutes. So you have to give like 1 minute for each MCQ and then you can spare on 20 minutes at the end just to go through whatever are the difficult questions which you have marked. So that is more important than just mugging up the questions because the questions can be quite variable in each year. So sometimes whenever I give an exam and I don't have much time, then I even just go through the most basic book which I have read during my DNP several times, that is Kanski. So I would usually just screen through all the cornea pages of Kanski, and I think even that helps a lot. Apart from that, you must know that it is like there are no negative markings. So you should attempt all the questions. 50% of the questions will be something like you will know the answers for the questions. Then 25% would be moderate questions and 25% would be hard. So try to attempt as many questions as you can. Don't try leave anything. There's no negative marking at all. Then for cornea, what I found, like apart from all these important topics, keratoconus was a very important topic, and knowing all the classifications of keratoconus, collagen cross-linking, and all the parameters of collagen cross-linking can help you during the exam. Apart from keratoconus classification, you should know the named classification. They usually ask which, they will give you an example and they will ask you what is the name of this classification. So you can try to at least see whatever names are there for each classification of different conditions. Then corneal dystrophy is a very important topic. I see 3D classification is something you should go through completely. Try to at least like just before examination, you should go through all the corneal dystrophies, all the pathology behind each and every corneal dystrophy. That is a very important topic. There can be even 2 to 3 questions on this. So even some questions on environmental conditions like vitamin A deficiency is very important. Some of the questions can be there on this condition also. So apart from that, all the other topics you can go through. And pathology, microbiology, and immunology related to cornea is something you should just check before the examination, that you can screen through all these topics also. Then for OSCE, which is the second part of the examination, you'll get a result after the written examination that you have cleared, and then the selected center for the OSCE would be given to you. So the OSCE part and the VIVA part would be in the same center. So firstly, you will go through OSCE examination, and then your VIVA would start. So for OSCE, 50% would be the cutoff. Usually 10 images are shown, 5 minutes each are given for each and every question. And they basically focus on the clinical scenarios, diagnosis of different conditions, investigations, treatment, and surgical complications. So you should go through specular, ASOCT images, topography images, and you should be able to make a diagnosis based on these images. That is important for OSCE. For VIVA, usually there will be like 2 to 3 examiners. Like for us, it was in AIMS, but for you, it can be anywhere. And it is like every center has a different pattern of examination. Like those who might have given DNB, they know that for every DNB center, the pattern of examination might be little different. So we can't say that each and every center would have the same pattern, but usually they have a case-based discussion. There can even be a table viva where they might keep drugs, instruments, and investigation, but need not happen in all the centers. So, but you should be prepared for that. So these are the few books which I usually go through, like for any of the exams, like basic and clinical science course of by AO, that you can screen through for the theory part also it might help, and even for OSCE as well as for VIVA. For VIVA, particularly, I like these 2 books, like Praful Maharana series. I just go through the cornea parts of these, especially for the investigations. The second book is also very good. So it helps for you for the instruments part, investigation parts, the imaging parts. You can go through, but obviously it's like a very specific thing that wherever you have read earlier from wherever, you should go through those books because these are the books which I read during my UG. Whenever I have less time, I go through them and then that helps me. So then for OSCE part, the Agrawal series of books were there, which came during the DNB examinations. So there are like 2 to 3 series which is available on Telegram. You can go through them for OSCE. Then obviously there are many online sites where you can go through like eOphtha and all those sites where OSCE questions would be available. So once again, it is not about just the same question, but it is about knowing the pattern of examination just before like your exams. You should just know how the questions would be, and you should have a practice of solving them within 5 minutes. So that's all from my side. That mainly it's for me, it's not like a specific book which you have to go through. It's mean that you should be prepared, like whatever you are reading during your fellowship, whatever you are going through during your PG, that is usually enough for these examinations. You don't need to mug up a lot, or you don't need to like go through entirely different set of books for these exams. But whatever is going during your fellowship, your academic like classes, your whatever sessions are going on during your fellowship, that is most of the time those are enough for you for the examinations. So this is means what I want to indicate is that these exams are not so difficult. So you should definitely attempt these exams. Even if you have less time, you can still survive in these exams. You can still pass through these exams. So don't be disheartened that your time is less because of maybe your fellowship or your post graduation or your maybe say your work, your maybe you are working in a hospital or something. Even then, even if you have less time, if you have gone through your books nicely during your fellowship, that should be enough, whatever you are learning. So thank you. Then once again, family support is important. That is why I've shown this photograph. And that's it. So if anything is required, you can ask me or all the other panelists. Okay?
Okay. Thanks, Dr. Pratima. That was comprehensive. I think you can just unshare your screen. And Dr. Raghav, are you there?
Yes, Dr. Anuj. I don't have a presentation because
Yeah.
Pratima did an excellent job of showing everything. I'll just add to it about my exam experience, basically.
Right.
So, in case if you are preparing for the exam, you have 3 months of time. I would say definitely you have to go ahead and read the cornea from Krashmer's. But if your time is less, like Pratima said, if you are doing a fellowship, you are juggling between multiple jobs, then reading basic Kanski will help you clear the MCQs. MCQs exam was not as tough as I expected it to be. So if you can read Kanski and do a couple of MCQs from any of the material you have, it can be American Academy, AAO network, which we have, or off the questions. This would be more than enough to do the MCQ part of the exam. But the more important part would be definitely the Viva voice and the OSCEs. So when you're preparing for OSCEs, like Pratima gave you multiple references from where we can get OSCEs as well. So the American Academy BCSC book is something which I used personally along with Kratchmer. Kratchmer is like the holy grail. if you have read Crashmer page to page, starting to end, I think that would suffice anything, everything possible in cornea. One other point I just wanted to mention is we did get few MCQs from cataract as well, few MCQs from refractive surgery as well, because there is a subtle overlap between cornea and these subspecialties. So when you go for your exam, be prepared that you might end up getting few questions about cataract. Could be congenital type of cataracts, traumatic cataracts, or the classification for posterior polar cataracts. So we did have few questions like that, and we did also have an image showing whether the patient is eligible for refractive surgery, what would be the procedure of choice. So you'll have to just prepare for the adjacent branches as well. Otherwise, it's pretty straightforward exam. I feel everybody who have completed 18 months of senior residency or fellowship should definitely write this exam, because like Pratima said again, this is one exam which unifies all the fellowships in the country. Otherwise, we don't have recognition in any particular board apart from Karnataka board, which has a specific fellowship entrance. None of the other state boards recognize our fellowships. So it becomes much more important, because now you have a unified presence when you give your FAICO exam. Saying that, over to you, Dr. Anuj, and thank you for the opportunity. One other specific book, I'm sorry, in the end, what I feel is Chua's MCQs. Professor Chua's MCQs are very important. So I have got multiple questions directly out of that book as well. So there is not one source for everything, but obviously, I think the question pool comes from multiple MCQ books which are there in the online platforms like the AAO, Chuas, and other books as well. So you try to do as many MCQs as possible. It becomes easy when you go for your exam. And one again, just to highlight the importance, one book you have to read is Crashmer. I think that would suffice any exam, and including the FAICO exam. Thank you.
Okay, thanks a lot, Dr. Raghav. So I think Dr. Pratima said in 2-3 months we can do, and Dr. Raghav is suggesting that maybe it will take another 5-10 years if you have to read Crashmer and give this exam. So no, just joking. But that is we've got quite a wide perspective, and Dr. Prabhat has also joined in. Now, Dr. Prabhat is a fellow from Shankar Nethralaya, Chennai, and he has, I think, double FAICO, Dr. Prabhat.
Yes, sir. Yes,
So,
sir.
would you like to talk about cornea first?
Yeah. So, can I differ from Raghav a little bit about
Definitely,
Crashmer?
that's what we want.
Right. So, I don't think that we will ever have enough time to read Crashmer. At least, I was never good with big books. I was never good with Harrison. I was never good with Robbins, and I'm not good with Crashmer. So, I would look for shorter books like BCSC, Cornea, or there is, how the Wills Eye has the emergency manual. They have subspecialty manuals as well, and their cornea and uvea manuals in particular are excellent. The reason for that is the chief editor of the entire series is Dr. Chris Rapuano, who is a cornea specialist. So the cornea manual is actually quite fantastic. In fact, if you are looking at a skeleton around which you will prepare your add-on preparation, then that skeleton, in my opinion, would come from the Wills Eye cornea manual. That's where you start, and that you can revise 3 times, 4 times, multiple times. The thing about MCQ preparation is that you need, in Hindi we say MCQ fasna chahiye, right? So you have to get it. For that, you need to remember a little bit. Again, I agree with Pratima that you should not mug, but at the same time, wherever you read from, it should be very easily revisable for you. So let's say that 2 days before the exam, you say, I want to do one more revision, which you would have planned in advance, then you should be able to do that. So in my opinion, Kratchmer will not allow you to do that because of the sheer volume that you're dealing with. Pratima has also covered most of the places where you can get MCQs. 2 more places are the BCSC book itself has about 50 MCQs at the end, and AAO One Network, which we have access through our AIOS memberships, they'll have about 120 to 150 MCQs in cornea. So that will help. finally, I old ones, corticosteroid disease study, mycotic ulcer trial, steroids in corticosteroid ulcer, steroids in corneal ulcer trial, and now they've got a parasitic ulcer treatment trial. So all of that should be read for both the theory and practical. In terms of the pass rate, cornea was actually quite notorious about 5 years back when I had appeared for the exam. The situation has improved quite a bit. So therefore, if you clear the theory, the chances are much higher that you will get through the practical if your examiners are well kind. And I get the sense that there has been an understanding amongst examiners and from the FICO board that if somebody is good enough, then they should be cleared. That's the sense that I'm getting over the past 2 years across subspecialties, because there was a time when 2 people would clear and now 25 people clear one subspecialty. So it's not just that more people are appearing for the exam. It's also that more people are being cleared. So if you get through the theory, it means you're good enough and you just need a little bit of luck and hopefully you'll be able to get through the practical and the OSCE.
Okay. So I think that is a very valid point because Cornea was notorious for that. The results were, it was actually single digit and in the near to less than
Almost zero.
5.
Yeah.
So I think that's why maybe the people were also like less people would be appearing, knowing that.
Yeah.
Yes. I think we've got pretty much hang out about how to go about cornea, and we'll take the questions at the end of it. We'll just move to little outside of cornea and outside of the eye. We'll move to plasty. And do we have Dr. Anju? Hi, you can just unmute.
Yeah. Hi, Dr. Anuj. I'm sorry, I don't have a presentation per
That's
se.
okay.
If Neha would have a presentation, yeah, she could go first.
No, with plasty,
But
just talk about it.
Okay. So regarding the exam, since we are already aware about the pattern and all that, when you need to take the exam is something that I would like to tell about because during your fellowship, you're already preparing a lot about the topic. You know quite a lot. But once you step out and then you get into your practice about, say, into 1 or 2 years of your practice, if you're not in a educational institution, you tend to start forgetting a few things. So at that point, if you're to take this exam, it's basically you revising what you had once studied. So it'll be like a recap. You can brush up what you've forgotten. You can update. That way, if you would take this exam, it would be a lot more interesting and you'll be able to give in more inputs. So that's one thing about when to take the exam. And topics in oculoplasty basically includes even the ocular oncology part. So for the OSCE part of it, we had questions that came from even genetics. We had questions that went into the depths of it, and there was even a couple of questions about the community part of it, the community of ophthalmology, the application part of it. But MCQs, since we have been taking MCQ exams over a period of time, I don't think time factor is a problem per se. You always have the option of going to the next question. So if you attempt those questions that you really know well first, you can always come back to the tougher questions, spend a little bit time over it, and then eventually you will get it. So the thing about when during a fellowship, it might be new things that you're learning. So for you to retain it, it would be difficult. But once you start practicing, when you apply it, the same way you will be able to apply it into a clinical scenario that comes into your as an OSCE, as a the MCQ questions. So when I gave my practical exam, we had 20 OSCEs for the OSCE session, and it varies from center to center. And the questions were quite basic, starting from clinical examination and even steps of surgeries. And it depends upon the examiner who sets the questions. You might even have a few questions about recent advances and all that. Coming to the VIVA part of it, we had all instruments that were kept. We had even specimens from pathology that were kept, then the implants and all that. So the difference that was from the previous exams were here they would ask us, how would you want to go about this case? Or rather, as a surgeon, would you take the decision to go ahead now? Or it was more that way. So they look at you as consultants and not as students who are looking to pass. So that's the good part about FAICO exams. And regarding covering topics, yes, I've always stuck to Kansky for going through pictures and all that, because that's a great revision. And our standard textbook is Smith and Nesi. I don't think we'll ever get through all the topics of it, and it doesn't have colored pictures. You can always refer to the online questions, OSCEs and all. What we had was a compiled set of MCQ questions that we had over previous years that was handed down to us, and we basically just solved those questions also like an add-on. But a few questions here and there were wrong, the answers were wrong, so you just had to check the key, and that was pretty much okay for the MCQ part. But for the practical side, yes, AAO is a good option. And also you have a lot of manuals or atlases that are available in Oculoplasty. There are numerous atlases that you can refer to, because when you're practicing, it's not easy to sit and read a topic per se. But when you look at a picture, it strikes and remains in your brain a lot easier. So going through atlases would be an easier point of it. And yeah, the rest is you like for every exam you have that butterflies and all those things. You get that nervousness. So I think that's the thrill of exams that makes us keep going for more and more. And yeah, that's pretty much. Thank you so much.
I think, yeah, Dr. Anju gets a lot of thrill in exam. That's why she's taking also a lot of exams and vivas these days. So
Yeah.
not everyone enjoys those butterflies, I think. But how long has it been when you applied, when you gave this exam, like when you took the exam?
I gave my exam in 2022 December. That's when I wrote the MCQ. And December or November, I don't remember the exact date. And my practicals I gave in Jan 2023.
Okay. And where was your center for Viva OSCE?
For OSCE, I had it center for sight. So the questions were set by Dr. Honavar himself. So
Okay.
that's why we had around 20 questions. So those are standard questions, and every, in fact, if one clinical picture were to be shown, there would be at least sub questions of 3 to 4, and you had to answer them. So that was his pattern, and we had Viva across 2 stations where 2 examiners each were sitting, and they had the different set. If one set were dealing with the drugs, the others were dealing with the instruments that way.
Okay. Okay. So I think we have now opened up the orbit. So we'll go to Dr. Neha. So can you just share about your experience and your inputs so that we can have another
Sure.
perspective? Yeah.
Sure, Dr. Anuj. So, thanks, Dr. Anju. She made my life easier. I think I have a very, very small presentation that I'll just share. Just some points that I'd like to cover. So, of course, Pratima covered all of this. It's the fellow of the All India Collegium of Ophthalmology by the AIOS. So I think it's established now that because we don't have ophthalmology fellowships which are recognized, and that is why this is a very nice way of standardizing your knowledge, your skills, that okay, this, you are trained in this specialty, and you have the adequate skills to practice this specialty. I mean, even without it, you can go ahead and do it, but it's just something that gives you that much extra say just a post-nominal degree sort of thing. So, and of course, medical students, as you said about Dr. Anju, she likes to study. All of us probably have to study for a long, long time. So why not get that shiny certificate and get a nice, convocation to go with it? It's nice. So anyway, and when, of course, Pratima covered it all, and I think we don't have to worry so much about all these technical details. 18 months, 3 years. They have on the website. You can upload all your, your certificates. So if it's valid, then your thing will get accepted. So you just have to have that much 18 months of either a senior residency in that particular specialty or a fellowship in that specialty. But don't get, it's a little it was confusing for me when I was applying. So I'm just saying that don't get confused about it. It's pretty straightforward when you're going on the site and uploading it. So this is this year's. So if anyone in the audience really wants to apply, so this is 15th August is the last date, and this is what came in my email. So I just sort of put it up as a screenshot, and these are the dates, relevant dates. September 14th will be your online MCQ test and all that. And any time between October to December will be your OSCE and VIVA. And something you have to remember is they tell you quite last minute. So, if you have plans, like you just have to sort of, you'll just have to be alert. Okay, they'll tell you that you've passed your first part, and then they'll tell you to wait for your second, for the intimation of the time and all that. So, I think I took it last year, and we were informed about 3 weeks in advance, and that's not a lot of time if you have to travel to another center and all that. So just remember that, that's all. And of course, January is the declaration of the results, and then convocation is during AIOS. So this is what comes in your email once you apply. So for oculoplasty surgery, it was like this. 120 minutes is the duration, and location, etc. They'll send you a admit card as is usual. This is something important for everyone to go through. I think rather than us telling you that, okay, study from this book and that book, everyone has studied from somewhere or the other while they are doing their fellowship or whatever, and their post-graduation. So just be comfortable with those books. That's completely fine. And of course, AO is something really good. You have a nice variety of MCQs, and the basic sciences books for oculoplasty, orbit, that's really good. And this is this revised curriculum. So if you go through, they'll have little points. Okay, so those points are something that, if you look at it, you'll know, do I know this topic? If you don't know this topic, then just go ahead and read it or revise it, so you'll know there are some topics that people are very comfortable with, and that will vary from person to person. So you just look at this, and it's very close to the curriculum. So what I'm trying to say is, if they tell you, okay, these are the topics we want you to know, the questions will be from those topics. So that is something that is a very good guideline. Anatomy, basic anatomy is also important for MCQ. So any of the good anatomy books you can read. Whatever you've read, I would say just go through that itself. Don't have to go through all of them. Whatever one standard textbook you've read, just go through those. Oncology, as Dr. Anju said, we have a lot of oncology-based questions in the MCQ. So wherever you've studied oncology from, plus the review articles from the Shields group or the original articles, those will help a lot. And these are the two things. Again, this comes in the mail, and OSCE is 100 marks, VIVA-OSCE is 100 marks. And OSCE, again, OSCE is different, I think, in different centers. So in Hyderabad, like in the Hyderabad CFS center, so it's projected on a slideshow, and then you sort of have to look at it, and then they'll give you the clinical scenario, and then there'll be 2 or 3 questions about it. And it goes really fast. So something that you don't realize is they change it. So you can't go back to the previous slide, or you can't go back to the previous picture. So if you miss the clinical picture, then you won't be able to answer the next few questions. So be very attentive, and you don't have to write, long paragraphs, just point wise is something that was my experience, that you just write it fast and be alert. VIVA-OSCE, I think it's a mixed bag. Anything, they can ask you anything, but of course, you should know important things like drugs, reconstitution of drugs, the doses, all of those. And, we had an MRI, we had CT scans, we had we had a pathology specimen. So, and instruments are also very important. Some instruments of historical significance is also important. So it may not be something that you're using every day, but something that is important, like the Wright's needle or something, you should know it. You should know the whole name of it, like the whole, like how we used to study in post graduation. So if you are able to say the whole name, that gives you a bit like an edge, I suppose. And also like small differences between, like, say, for example, if you have a bone punch, you have to say the whole name of the bone punch. So if it's Citylis or Kerisins, and then they can ask you what is the difference between the two. So it's not necessary that you're always using those instruments every day in routine practice, but it's like the basic set of oculoplasty instruments that everyone should know, even if it has historic significance. That's it from my side. I think, yeah, those were the important points that I wanted to cover.
Okay, thanks, Dr. Neha, and thanks for preparing that presentation in a very short notice.
Yeah, half an hour.
Yeah, so that is amazing, and I think that's why your speed is you could match the OSCE, and I think because Dr. Honavar is the brainchild for this FAICO, that is why I think oncology is pretty dominant in oculoplasty, and I think that the slides and all is his style only because even for DNB exams he would prefer to have slides. So I think we'll go to our next speaker. Do we have uh, Dr. Shalmali Bachao?
Hello and good evening,
Yeah,
Dr.
yeah, yeah. So I'll just introduce Dr. Shalmali Bachao. She's a oculoplastic surgeon from Thane.
And do you want me to speak a few about my?
Yeah, please go ahead, doctor.
Uh,
I think I'm adding a lot of historical context now because I gave the FAICO exam in 2015 and 16, like end of 2015 basically. So it's been a long time, and I'm seeing the way the exam has somewhat changed till now. I gave my like online theory exams in Mumbai, and I gave my practical FICO exam in Gangaram Hospital, Delhi. And I also have some this because my DNB exam was in LVP. So we had Dr. Santosh Honavar there. And we have seen this system that you spoke about, slides and this to discuss about. So that's what we had. It's changed quite a bit. I think in the sense the oncology predominance has only increased, but even then there was quite a bit of oncology as there is usually at least one question on retinoblastoma in every OSCE. Then we also had videos of surgeries, especially like any LPS surgeries going through the conjunctival side. Surgeries, not all the surgeries are done by the skin approach. So those sort of things that might flummox people who are not really different or a wider scope of surgeries. So we had a lot of surgical videos as well. And other than that, theory, I think nothing can beat the detailed amount of this that Neha has made. I think she has covered quite a bit. Plus, now you have a curriculum as well. When we went in blind, and the pass rate was not very great. But thankfully, in the practical, the Viva part, most of us had cleared at that center. And I think that's about it. I think the more recent experiences are more valid because the exam tends to keep going in a certain pattern and it's become more standardized now. That's what I feel.
Yeah. I think that retinoblastoma is even for retina fellows or even people who are come out of a LV Prasad, it doesn't come naturally that retinoblastoma is part of retina oncology. You just tend to put it that that is oculoplasty. this. So I
Hmm.
remember residents asking me, and I would say, how would I know that? You have to ask your plastic colleague about retinoblastoma. So oncology, I think it has influences of Dr. Honavar, and I think we have covered plasty in depth, and because retina is our favorite topic, I think everyone will agree. So we'll go to Dr. Nikita Dash, and so Nikita Dash is currently at Bhubaneswar, and please tell us about your FICO experience.
Yeah, I'll just share my slides.
Yeah.
Is this visible?
Yes, yes.
Okay. Okay, so I just gave my FICO recently, like in November 2024, I appeared for the theory, and then I had my practicals on March 2025 at CSF New Delhi. And like the pattern has already been discussed, MCQs in the written and qualifying round, no negative marking, and you have to score about 70% to qualify. And the part two is OSCE and VIVA worksheet. So I'll go through this one by one. Uh, in the MCQs portion, we have a lot of basic question like basic anatomy, physiology, and investigations related to fundus fluorescein angiography, FAF, OCT, OCTA, B scan. And what I would like to stress is you also need to know that these are mostly direct questions, and you should be very careful about the numerical values related question like thickness, then micrometers and the wavelength and all these things, these numerical values which we tend to confuse or we tend to forget. You just write them down in one piece of paper and revise it just the day before the exam. That will be very helpful. And be very careful the thickness and all these things, physiology also, like blood supply, these questions are very important. And in FFA and FAF, all these the wavelengths are asked, and OCT, how many scans, the SSOCT, what are the number of A scans, axial scans taken. So all these things you should be very careful. And B scan, what is the hertz, all these numerical values you should be very clear, so that you don't get confused in the last minute and cause a silly mistake. And mostly you'll get basic questions regarding this. They don't twist anatomy and physiology questions too much. And coming to the retina and vitreous topics proper, diabetic retinopathy, and you can get questions on trials as well as case related scenario. Like they'll give you a case, like this is a patient, they'll give you an OCT picture, and they'll tell you this is a patient, how will you approach the patient, or this patient has been given anti-VEGF for this many months, not responding, how are you going to change, all these things. Then there will be CNVM, dry and wet ARMD, PCV related questions, then other biomarkers related to all these questions, myopia and its degeneration, like myopic CNVM, um, and other they can also give you pictures related to myopic degeneration, lattice, when is how common is it, the percentages and all. And how are you going to treat a lattice, how are you going to treat atrophic holes, how are you going to treat an impending, what is a subclinical RD, all these things. Then anti-VEGFs is a very favorite question. The they asked us about faricimab and its dual mode of action in the during this session. And so it's be very specific about all the molecular weight of these molecules, because how many kilodaltons, brolucizumab, faricimab, and their trials, Tenaya, Lucerne, and Kite, Crystal, all these trials. And BRVO, CRVO, everything trials, case scenarios, retinal detachment, Linkoff's rule. They'll probably give you a picture of any of the Linkoff rule and tell you that according to this clinical picture, where do you suppose that the break is present. And dystrophies and degenerations, it can be presented as a case scenario or a photograph. OCT pictures also, like CSCR, they'll give you a serious detachment, and then what is the clinical diagnosis, how are you going to approach this patient. And procedure, surgeries, and vitreous substitutes, these are also a very important question, like very favorite question, because the questions are easier to frame with these vitreous substitutes, like what are the gases, the time of expansion, what time of expansion, volume of expansion, when to give, when not to give. Your patient is wants to fly, how are you going to advise, what not to advise, all these things they'll ask you and the MCQs. And it's not very difficult. Like if you have a basic idea and you have like done a bit of work in the subspecialty, you can very well appear these and tackle these questions. And with OSCE, there can be clinical scenarios, FFA, OCT, Octal investigation, fundus photo and related clinical question. They can also give serial photographs of lesions and tell you that what exactly is going on here. And I found that if, apart from the textbooks, if you have a serious crunch of time, like you really can't really study for anything, then these iFocus videos are really good. There was a video session by I think Dr. Prashant Bhavankule on I think PG OSCE session or a Retina OSCE session that was really helpful, and another few OSCE sessions VIVA questions like OSCE videos of iFocus were also there. So I went through them, and they give you pretty good learning points, and you get a hang of the questions that can be asked, probable questions. And for the Viva Watchy case scenarios also, you can go through the iFocus videos if you have a really shortage of time, because there are a lot of like case scenarios there also. And and they have a varied case scenarios. And in Viva Watchy, what they'll do is they'll essentially give you a photograph of a patient, like supposing the patient will have a CRVO or something, they will tell you to describe the fundus photograph, and what do you think, how are you going to proceed. Basically they'll test your acumen as if you are a consultant. And they can also give you a case scenario like, this is a patient of cataract with ERM, vision is this much, how are you going to approach the patient, are you going to like peel the ERM off in the first sitting or not, going to do a combined surgery, or are you going to wait and watch for the vision improvement and all these are the sort of questions they ask you. And sometimes they can also confuse, ask you a made up scenario also, and tell you like ask a question like, what makes you think that this is not the case. So you really have to have a good presence of mind, that's all. And they can ask you questions on ROP, the recent ICROP3 classification, coloboma classification. If there are classifications, please do learn or mug up the any standardized classification, because you can be asked. I was asked about coloboma and its classification. And there can be questions on instruments, techniques, tamponading agents. They'll keep like silicone oil or PFCL, or even any dye, anything like that they can keep. And recent advances if the examiner has the time or is in the mood for any like further questioning. So I really had a crunch for time. So I did the retina and vitreous portion from this review of ophthalmology and retina and vitreous MCQs from AO. And I also had a questions from question bank from the IQ question bank, which is I think for the FRC of part 2. So it was circulated in Telegram, and I had got hold of the retina part. And so I went through these questions because a lot of it was covered in these questions. And but of course, wherever you feel that there is a doubt with what you are you with the answer you have in mind and the answer that they are giving, kindly go through a like standardized textbook. And for pictures and all, you can go through Kansky. That would suffice mostly. And why you should do it, because it does give you a good revision and you can be at par with your peers. And it's a great starting exam, like if you really want to go and give standardized exams like for further like FICO and FRCS, it serves as a good starting exam and it does not burn your pocket. So you can start with FAICO. And it also give you a good photo op opportunity. And this was my photograph at the APA Congress, where I was awarded my FAICO. So that's all. Thank you.
Okay, that was interesting, Dr. Nikita. So In Retina, was there any oncology? Did you feel that there was any overlap with
The
molecules?
mostly is a UVL melanoma or it can be PVRL.
Okay, but no
UVL melanoma or
retinoblastoma.
PVRL. And certain chirpy lesions.
Right.
That's all. But they don't ask retinoblastoma too much. And I would like to add that you did not worry about mudes and all those things,
Okay.
retinochoroiditis too much.
So that would
Like
go in
you
UVA.
can read toxoplasma, which are really overlapping, or AR and all these things you can read, but they won't ask you too many questions on that.
On
On
UVA, it
mudes,
would be.
white dot syndromes, they will absolutely not ask you any questions. So that was relief
Okay.
because that,
So it will be
they
exclusive
asked me.
retina and no
Yeah.
UVA as such.
No,
And
no UV as such.
okay. And
Because for UVA, they have a separate exam.
so in the, if you remember of if, or if anyone knows, in the eligibility, does it mention a surgical retina fellowship or how is it? Because I have a few people who have asked like for a medical retina, are they this? I have
No,
mailed Dr.
because
Munawari.
my fellowship was surgical retina, so I did not face much problems. I actually have no idea. I guess it will be better if you have like experience of a senior residency and a medical retina fellowship also of 6 months or so. That would give you a good enough experience to like go ahead with it. But it is the questions can be surgical retina related.
Okay.
So a medical retina fellow might be at a disadvantage, like while preparing, they might have to prepare more or
Right.
like when questions are asked, they start with surgical retina questions only.
Okay.
Like what are these tamponading agents? What is the viscosity of the silicon oils? Or available viscosity, why was like high density silicon oil not so popular? Why is it not so popular? When will you use a 5000 centistrokes? So these questions a medical retina fellow might not know, and that
Right.
they'll be at a disadvantage. So that is one thing, one
Because
problem that
the
can be.
degree is only FAIC or retina, right? It doesn't mention
Hmm.
any.
Yeah, it does not mention that,
Yeah.
but yes, you do get questions asked on like
More on.
even in OSCE also, they can give you a picture of PVR. Like I was given a picture of PVR, I grade this. How are you going to manage this?
Okay.
So obviously, a surgical retina fellow knows like
More.
what will be for grade one, grade two, and if it is an advanced grade PVR, then how they are going to tackle.
And
So.
were there any histopathology slides in the OSCE for?
Histopath, I don't remember as such. Even if histopath is there, then it's always associated with another clinical photo also. They
Okay.
won't give you just basic plain histopath.
So as a retina person.
There will be a clinical scenario, something, and there will be an associated clinical photo or other investigative photo. They
Okay.
give a bunch of like multimodal imaging.
Okay. So you
As
have
far
a
as I know.
basic
Only when
idea.
it's purely, like very common diseases like diabetic retinopathy, that's when they can give you the only fundus photographs.
Okay. And for you also, it was on a slide or was it?
It was on slideshow.
Okay.
Slideshow.
It was on a slideshow. Okay.
Yeah, it was on a slideshow.
And yours was in CFS Delhi or in AIMS? Where?
I think the written was obviously at a computer center, and for my practical exam, I appeared at CFS Delhi.
CFS.
Uh,
Okay.
Dr. Lalit Verma and Dr. Mangal Dogra, they were the ones who examined me.
Okay. Nice. So I think we have covered up retina as well, and we'll just take questions in a short while. Dr. Prabhat, are you still there?
I'm here.
Yeah. So can we talk something about pediatrics and how was your exposure and how was the preparation and
Yeah. Thank you, sir. So I gave the exam the same time as Nikita did. That is, I appeared for the theory in November 2024, and I had chosen Bangalore as my center. Since I'm from Nagpur, all the centers were essentially the same for me. And it was conducted at a management institute on a Sunday. And once we cleared that, then we went for the VIVA at Shankara Eye Hospital, Bangalore. So, if there are any candidates here who are appearing for pediatric ophthalmology and strabismus next month, I want to tell you that you already know strabismus. But what you don't know, unfortunately, because of the way fellowships in India are structured, is pediatric ophthalmology. So they can ask you retinoblastoma, which we've been discussing for a while now. They can ask you retinopathy of prematurity. They can ask you corneal dystrophies in a pediatric population. They can ask you about Peters anomaly. They can ask you about Axenfeld-Rieger. They can ask you about congenital glaucoma. They can ask you about pediatric retinal detachment, none of which you practice, all of which will show up in the exam. They can ask you about neurocutaneous syndromes. Maybe you would have seen 3 patients in your entire lifetime. So we've been talking about the overlap amongst subspecialties, and I'd like to categorically state this, that in terms of the overlap, nothing beats pediatric ophthalmology and strabismus, because there is no bar when it comes to the MCQ exam. In fact, about 50% of the questions will be pediatric ophthalmology, not pertaining to strabismus, and the remaining 50% will be exclusive strabismus. When you start out preparing for the exam, you tend to believe that strabismus is far more important, and you start reading, and then you speak to other people, or you attend programs such as this. And that's when it hits you that, all right, maybe I've been neglecting pediatric ophthalmology because I thought that it won't be that important, or maybe on a subconscious level, I was less confident about it. Well, it has to change, because those are the questions that will pull you down in the exam. You know how to do a cover test, you know about Duane's retraction syndrome, you know about monocular elevation deficit, you know about dissociated vertical deviation, but you don't know about neurocutaneous syndromes, you don't know about genetics of various disorders, and whatever else I have mentioned in the beginning of this conversation. Now, as I mentioned in the beginning, there has been more tendency amongst the examiners to increase the pass rate, but that only applies once you have cleared the theory. So how do you go about clearing the theory? Well, when I was talking about cornea, I had mentioned solving the AO MCQs. So I did do that for pediatric ophthalmology. And in terms of reading for strabismus, I read Pradeep Sharma. But most of those who are pediatric ophthalmology trained, you may read whatever you have been comfortable with, because I was also recommended that you may go ahead with Van Noorden or Rosenbaum. But I'm not trained in strabismus, so I chose the smallest book that was available. And for pediatric ophthalmology per se, again, if I talk about a skeleton around which you would, branch out your preparation, then it would be the American Academy Pediatric Ophthalmology and Strabismus book, the pediatric ophthalmology part. So that will really kind of form a foundation. That is AO for pediatric ophthalmology and Pradeep Sharma for strabismus, to be able to solve the set of MCQs. Now, in terms of the MCQ books, the books that Pratima showed, I think, were quite perfect. They also apply to pediatric ophthalmology. That would include Kenneth Chern, that you read for FICO2, Mass Eye and Ear, that you read for FICO3. So, and AO I've already mentioned, and One Network also I've already mentioned. So going through the MCQs again, going through the genetics again, going through the neurocutaneous syndromes again, going through the stages of ROP again and again, are all things that will help you on the day of the exam, in spite of all of that preparation, because you're essentially reading half of ophthalmology, because everything that can pertain to a child's eye can and will show up in the exam. Therefore, you may walk out of the exam hall feeling that you are not going to clear this exam because it was so hard. So the theory paper is going to be tough, and it's probably great if you know that in advance, and that help you prepare a little bit better. Once you've cleared the theory, you end up appearing for the exam, which I mentioned in our case was at Shankara Eye Hospital, Bangalore. There again, the OSCE and VIVA, so I'm not going to go into the pattern, but the one thing that I did realize was, in the OSCE there was a little bit of pediatric ophthalmology and myopia. I forgot myopia for the theory as well. Please read myopia. Myopia is going to show up in all parts of the exam, because that's what's hot right now in pediatric ophthalmology. So look into the use of atropine, look at the ATOM 1 and ATOM 2 studies, look at the amblyopia treatment study, look at the infant aphakia treatment study, and then look at DIMS, look at HALT, look at OrthoK, read all of that. There is a book on recent advances that I have on my laptop. I can share it here. So you will be able to go through recent advances in ROP, recent advances in retinoblastoma, recent advances in myopia, the pathogenesis of progressive myopia, etc., everything is there. You may go through it if you have the time. And like I mentioned, the OSCE will have pediatric ophthalmology. So you can have disc coloboma, you can have myelinated nerve fibers, you can have retinopathy of prematurity, you can have anterior segment coloboma. The VIVA will mainly focus on strabismus because nobody from Retina or Cornea is going to come for the VIVA. So it's mainly strabismologists who are going to take the VIVA. So that therefore the VIVA will mainly focus on strabismus. But in our case, they were very thorough. They even went up to craniosynostosis and associated strabismus. So there your strabismus knowledge will you will find a way for it to shine through. But in the theory and in the OSCE, it's all 50-50. Pediatric ophthalmology is as important as strabismus, and because pediatric ophthalmology is our weaker suit, we need to focus more on pediatric ophthalmology. Everything else that the previous speakers have mentioned in terms of the fact that it really crystallizes your knowledge and brings you at par with your peers, and in terms of the fact that it really is a great feeling when you're there on stage and Dr. Namrata, Dr. Santosh Honavar, and everybody else is felicitating you. All of that is quite fantastic, and I agree with all of that 100%. And that's it, sir.
Okay, lovely, lovely. So I think that is a very important point which you have made, that while
Sir?
preparation, yeah, I think it's a very important point which you have made for preparation, that one needs to focus on pediatric ophthalmology more in terms of squint. And congratulations to you to clear both of them, because to know two subspecialties and to get it, get a certificate for it is really an achievement. So I think
Thank you.
we have covered most of it. We've missed uvea, we have missed cataract and glaucoma and neuro-opthal. So maybe we'll come up with those also. And if anyone in the audience has any question, I think we have our faculty still there who can take the questions. So if anyone has, just can take the mic and go ahead. Okay, I think all the points have been covered mostly. What point I would like to ask is, as a frankly, if somebody doesn't want to give the exam, does he lose out anything if we are being an, what do you say, a devil's this advocate? And is there actually anything to lose if somebody is not giving the exam? Is it just FOMO, which we find when we check the Facebook and we see, oh man, he's on the stage and I am not there?
Can
Or
I answer that?
but does it add more value to it? Is it just for the showcase, or is it really, do you feel that it's an achievement and it is a must? So this is a little controversial question, because none of our sessions are with allegiance with AIOS, so we can go ahead. Maybe Dr. Honavar may not like it. Please.
So, in terms of your career growth, it is not going to make any difference. Let's be very honest. It's not like it's, say, a ticket to the US, like you give your FRC off, then you can get a GMC registration. That is not going to happen with the FICO. But, everybody else talked about reading in fellowship, and I was very impressed because I never read a single word during my fellowship. We were just working. So I was not reading. If you had a presentation, you read. Somebody else had a presentation, you read the journal he sent you. But other than that, I was not reading a book. So when you walk out of fellowship, my wife is a super specialist gastroenterologist, so I know how much she has prepared for her final exam. I didn't do any of that when I finished my fellowship. So therefore, to bring your knowledge together, to try and crystallize it all in your mind, this is a great way to do it. And you walk out and you then walk into your clinic as a better clinician. So I don't think you can put a value on that. at least in my case, that did help. The photo op and all is, of course, a great bonus, but in my case, it did help clinically as well. And certainly for pediatric ophthalmology, for me, there was no way I could have managed anything in practice without for PEDOF, because I'm not fellowship trained in PEDOF. So definitely in terms of the knowledge, there is no doubt that it helps, and therefore it helps your patients whom you're doing this all for in the first place.
Okay, okay, that is very nice. Dr. Anju, you want to speak something?
Yeah, I agree with what Prabhat said. I don't think it changes anything in your career growth. But I think there's another aspect to it. Probably they're trying to standardize our fellowships across India and trying to bring this, encourage everybody to take it so that over a period of time, like how you register with, the various medical councils, the same way this might be a ticket to that. Like you be a registered subspecialist in this particular field. So if that's the intent, yes, there's a bonus in taking it quite early on before it becomes more competitive.
Okay. Yeah,
If I can add, I have one
yeah,
one
Dr.
s-
Nagam, please.
one point about it. So probably I am a little far-fetched on it. AIOS did start on the travel grants and stuff right now. So probably in times to come, they would say FAICO is like a mandate you need to have to apply for one of these grants. Probably that is what the future foresees us right now.
Yeah, I think it is more. It is you. They get more membership. One has to become a AIOS member, and they are sort of it, as Dr. Anju said, that it is sort of a leveler that everyone is at that level, and now even they have started with OCAT, so they are planning for even residency. So, but yes, anyone else, Dr. Pratima? Yeah, please. But you're not audible. No.
Am I audible?
Yes. Yes.
Yeah. So what I would like to add is all these exams are not for others mainly. It's mainly for us. First of all, like as all our speakers said, that it gives you a chance for revision and all those things. Apart from that, what another aspect I would like to add, it builds up on your CV also. So like I had in the introduction you told me that means it told everyone that I had gone for other fellowships and all those things. So when you are applying for fellowships abroad and when you are applying for maybe awards, maybe something else, so these give you a like extra edge to others. Like there are hundreds of candidates applying for so many things. Okay, so if you have like extra degrees, extra awards, extra fellowships, extra anything extra apart from others, that gives you an extra edge. So over others, because everyone will be like everyone nowadays have done some fellowship. Everyone has gone through something or the other. Like they have some experience. They are like clinically good. Many a times people have read research also. So how to go an extra mile? So these are some things like giving certain exams. They give you an extra mile, and they shows others that you have put those efforts into it, right? So when you are applying for certain scholarships, fellowships, I think then means it matters. Like your CV matters. So how good your CV is. So it helps in that. Even if you are applying for a job, say, so I think even there your CV would matter, your degrees would matter. Yes, now I am a private practitioner, so I can confidently say that what.
No, we lost you, Dr. Pratima. No.
Yeah, so now am I connected?
Yeah.
Well, that. So for your clinical practice per se, the patients might not know that what is the extra like degrees you have added to your name, like FICO, FICO. The patients might not recognize these degrees. Yeah, it might give you an extra edge again, even like if someone is standing like seeing your board versus someone else. But I don't think patients per se see all these things. So for your private practice and all that, it might not help you as much, but for your professional like academic side, it might help you, like if you want to apply somewhere, if you want a job, or just your academic side. So that is something which I would like.
Okay. Anyone else would like to comment? Yeah, Dr. Nikita.
Yeah, I agree with Dr. Pratima. Like, in your practice, it's not going to make a difference per se, because whether you have passed an exam or not passed an exam, what is more important is what is your clinical acumen. That is how you diagnose the patient and treat the patient and manage the patient. But yes, when you're applying for certain institutes, like when I was applying previously, when I was applying for AIMS Patna for the post of assistant professor, they have a specific column for the your fellowship awards, and that's where you can like add it. So certain institutes, yeah, they do give importance. Certain central institutes or even PGI, AIMS, all these kind of institutes, they do give some importance. But yes, if you're not into that and into private practice, it won't matter much, because frankly speaking, our patients, they won't know like what is it, what is a FAICO, what is this FRCS. They are not going to know. Let's be very frank about that. And so eventually it boils down to just personal choice. Like if you really want to give it, go ahead and give it. Like I gave it because I was actually preparing for my fellow of national board exit exams in vitreoretinal surgery. So I really wanted to give an exam so that I can just sit down and study at least something related to OSCE and case scenarios and all these things, because I was hardly getting any time in my fellowship to study. So I gave that exam just to basically study. And yes, I think it's a good exam for giving, if you like, if you feel that no, I'm falling behind with my academic knowledge and I really need to study what's going on, and I'm like letting go of my like knowledge and all, because once we get into practice, we only read on a patient basis. We see a case and then we try to read and research on the patient or something like that. But after we pass our PG, it's very difficult to sit down and read per se as we used to read. So, so yes, it should be a purely personal choice in my opinion.
Okay. Thank you. Thank you. I think anyone else has any comments on that? Okay, so I agree. I feel it is more of a personal this and personal accomplishment when we feel there is a need to maybe prove to ourselves, and in some cases where there is where there is no proper a fellowship or a training as such, and where you feel that there is a need, like someone who's a cataract surgeon or like Dr. Prabhat, he said he can do squint, but he doesn't have a fellowship trained degree. So he has a point, and he can show it to others also, that there is a sort of a acceptability to his skills. Apart from that, for CV, maybe I disagree. In India, as such, will not add to this, and for fellowships also, if Dr. Pratima would agree that now IOFF has also started fellowship, but everyone is getting the fellowship even without clearing the FOF exams. So these exams, because they only cater to the local level, may not have so much of implication outside of India. But yes, as Dr. Nikita had said, that it is a good starter. And I don't know whose slide was this, that it is one of the cheapest exam to give. So I think the rate is very
So
uh,
that was my slide actually.
yes, yes, yes.
It's 10,000, so
Yes,
it's one
so
of the
at
cheapest exam to
10,000,
start.
it is not something you would repent, even if you feel that the results were not favorable, because and it is a good starter, because it will give you a heads up if you want to go for FRCS or any other exam which may be competitive in nature, and it will really help you. So, Dr. Shalini, you would like to add anything?
Yes, I listened to all the points made by everyone else
Yes.
regarding AICO, which is very good. And I would like to tell that I gave FICO after completing DNB. Then I gave FAICO because it was just recently introduced in that time. And I would say ki I gave it just because I thought ki it would give me motivation to read during my fellowship, which it did. And I mean, as a stepping stone to other exams, it's fine because you will end up reading the same material, but you are confined to one specialty, whereas all these other exams, FRCO, FICO, cover the entire ophthalmology. So actually, there's no comparison. That time I was anticipating it would be needed for some other things, like people are saying travel grants or as a standardized fellowship exit exam, but that hasn't happened in 10 years. So maybe it might have a shorter timeline now. But I did feel that it was worth giving. It was good to test your clinical knowledge, and it definitely makes you a better clinician. And it is more of a standardized exam, so it's good. As a fellowship, we generally go in for surgical exposure and maybe clinical exposure, but being tested on something is also important, and I think this exam fills that gap. But yeah, it is not really something that is compulsory, or it's going to give you any kind of advantage as of now.
Yeah. So I think that sums up, and the good part about it is that the vivas are friendly. It is not a scary place to be when you go for the Viva, and quite a few times you actually met them, and if you have done fellowship in these years, you sometimes you have met those people and they know you. So it is like a friendly environment, and like they used to say that in DNB or this they want to fail you or this. So that is not the tendency for the Viva. So you come out with a positive after the exam. It is not a very stressful time, at least the Viva part, I feel. So I think if there are no more comments, we'll end the session, and we've had amazing time, and thank you everyone, because it was such a short notice and everyone joined, because there's so much lack of information on this topic, and I also have given the exam like 10 years back, so I don't know what is the current scenario, and so we could get everything about most of the specialties, and let's hope we can get other specialties also. So I think we'll wrap up for the day, and thank you everyone. Thank you once
Thank you,
again.
sir.
Thank you everyone for joining.
Thank you.
Thank you. Thank you for
Okay,
giving us this
thanks.
opportunity.
Thank you so much.